When we talk about the deadliest forms of cancer, lung cancer always rises to the top of the list. Not because it's the rarest, in fact, it's one of the most common, but because it often grows in silence, unnoticed, until it's already taken hold. Lung cancer is the leading cause of cancer-related deaths in both men and women, not just in the United States, but worldwide. Every year, it claims more lives than breast, prostate, and colon cancers combined. Yet, despite these staggering numbers, many people don't realize how vulnerable they are, or how subtle the early signs can be. You might assume lung cancer only affects smokers, that if you've never touched a cigarette, you're safe. But that's not entirely true. While smoking remains the primary cause, it's not the only one. Exposure to secondhand smoke, air pollution, radon gas, and even genetic factors can also play a role. Lung cancer doesn't discriminate. It can affect anyone young or old, smoker or non-smoker, man or woman. What makes lung cancer so dangerous isn't just how it starts, it's how quietly it grows. In the early stages, the lungs can harbor a tumor without causing any pain. You might feel a little tired. You might develop a cough that doesn't quite go away. Maybe your breathing becomes slightly heavier when climbing stairs. These signs seem harmless, easy to ignore, easy to explain away. That's the trap. Lung cancer is often discovered only when it's already spread. By then, options become limited. Treatment becomes more about managing symptoms than curing the disease. And that's why early detection isn't just helpful, it's essential. The earlier you catch lung cancer, the better your chances, not just of surviving, but of returning to a full, active life. But how do you catch something so quiet, so hidden? The answer lies in awareness. In this video, we're going to help you recognize the signs of lung cancer that often go unnoticed. We'll talk about the subtle changes that many people overlook. We'll show you what to pay attention to, and why every cough, every breath, and every small change in your body could matter more than you think. No, we're not here to scare you. We're here to empower you with clarity, with knowledge, and with tools you can use to protect your life or the life of someone you care about. Because when you understand the threat, you can face it. And when you face it early, you give yourself the best chance to beat it. Let's dive in and explore why early detection of lung cancer can make all the difference. Lung cancer doesn't usually knock on the door with a loud warning. It slips in quietly, hides in the shadows, and builds its strength long before anyone even knows it's there. And that's exactly why early detection is so critical. In its earliest stages, lung cancer can often be treated more effectively. In fact, when caught before it spreads, patients may have a strong chance at recovery, even complete removal of the tumor through surgery. Some go on to live many more years of healthy, full life. But here's the hard truth. Most people don't catch it early. Why? Because the symptoms in the beginning are often mild. A slight cough, a bit of shortness of breath, maybe a chest discomfort that comes and goes. These signs are easy to dismiss, especially in older adults who might already deal with minor breathing issues, allergies, or fatigue. That's the danger. The human body is strong and adaptable, but that strength can also mask what's really going on. And let's be honest, in our fast-paced lives, most of us don't slow down long enough to check in with our health. We chalk up warning signs to stress, the weather, aging, or maybe even a lack of sleep. We push through, thinking it's nothing, until one day we find out it wasn't nothing after all. This is where awareness becomes more than just information. It becomes a form of protection. When you know what to look for, you know when to act. You see, lung cancer, like many other serious illnesses, doesn't explode overnight. It evolves, and with the right tools and the right mindset, you can catch it while it's still manageable. That's the difference early detection makes. It gives you time. Time to treat, time to recover, time to live your life. Think about this. Most of us wouldn't ignore a fire alarm. We wouldn't brush off smoke coming from the kitchen or pretend a strange noise in our car doesn't matter. So why do we ignore signals from our own bodies? Your body speaks to you, not always in words, but in changes. Changes in how you breathe, how you feel when you walk, how your voice sounds, even how often you clear your throat. These things may seem small, but together, they form a message, and that message may be telling you to take a closer look. Early detection is about giving yourself the best fighting chance. It's not about fear, it's about power. It's about recognizing that you are not helpless. You are not at the mercy of fate. You have a choice to pay attention, a choice to take action, a choice to protect your future. The good news, you're already doing that right now just by watching this video, by learning, by becoming aware. In the next section, we'll talk about what those early signs actually are. Not vague ideas, but real, specific symptoms you can recognize and act on. Let's move into the signs of lung cancer that matter most. If there's one truth about lung cancer that every person should know, It's this. It often speaks in whispers, not shouts. In its early stages, lung cancer doesn't always come crashing into your life. Instead, it tiptoes in quietly, sending out signals that are easy to overlook until they grow too loud to ignore. But if you know what to look for, you can spot these signs early. And when it comes to lung cancer, early can mean everything. Let's go through the most common early warning signs that your body might be sending. 1. A persistent cough that doesn't go away. We all get coughs, maybe from a cold, allergies, or dryer. But if you develop a new cough that lasts more than 2 to 3 weeks, especially if it worsens over time, it's time to pay attention. This isn't the kind of cough that clears up with tea or over-the-counter medicine. It lingers, it nags, and it may be your lungs trying to say, something's not right here. Even if it feels mild or seems harmless, don't ignore a cough that refuses to go away. 2. Changes in a chronic cough for people who already have a smoker's cough or a chronic cough due to other conditions. Any change in the nature of that cough can be a warning sign. Is it deeper? More frequent? Does it sound different? Is it now producing bloody or rust-colored mucus? Any of these changes could be a red flag. If your regular cough suddenly isn't so regular anymore, your lungs may be asking for help. 3. Shortness of breath. Do you find yourself getting winded more easily? Maybe you're out of breath after climbing stairs you used to handle with ease. Or maybe simple tasks like walking to the mailbox feel harder than they used to. Shortness of breath, especially if it's new or worsening, can be a subtle but serious sign. It could mean a tumor is blocking part of your airway or causing fluid buildup in the lungs. This kind of breathlessness isn't just about being out of shape, it's your lungs struggling to do their job. 4. Chest pain or discomfort. Chest pain doesn't always mean a heart attack. In the case of lung cancer, it may present as a dull ache, tightness, or sharp pain, especially when you breathe deeply, cough, or laugh. This pain might not be constant. It can come and go, and it might be easy to dismiss as muscle strain or something minor. But if it persists or feels different from any pain you've had before, get it checked. 5. Hoarseness or voice change. Has your voice changed recently? Has it become raspy, deeper, or weaker over time? Lung cancer can affect the nerves that control the voice box. If you're noticing that you sound different, or others are commenting on your voice, and there's no sore throat or cold to explain it, pay attention. This is especially true if the change lasts more than a couple of weeks. 6. Frequent lung infections, bronchitis or pneumonia. If you keep getting bronchitis or pneumonia in the same area of your lungs, that could be a clue. Sometimes, tumors block airways and make it easier for bacteria to settle in. You treat the infection, feel better for a while, but then it comes back, again and again. Recurring respiratory infections should never be ignored, especially in adults. 7. Fatigue that doesn't go away. We all feel tired sometimes, but this kind of tired is different. It's a deep, dragging exhaustion that rest doesn't fix. You may feel drained in the morning, wiped out by afternoon, or like you need naps just to function. Fatigue is a common symptom of many cancers, including lung cancer. It can appear early, before any cough or chest pain. 8. Unexplained weight loss. Are you losing weight without trying? Is your appetite shrinking, and you're eating less than usual? When your body is fighting cancer, it often burns more energy even if you're not more active. Lung cancer can also affect metabolism and suppress hunger. Losing 10 pounds or more without dieting could be your body's way of waving a red flag. 9. Bone pain or body aches. In some cases, lung cancer spreads early to other parts of the body like the spine, hips, or ribs. You may feel deep, aching pain, especially at night or when resting. This is more common in later stages, but in some people, it can show up early as a confusing symptom. If you have new aches in your bones that don't feel like muscle soreness or arthritis and they persist, it's worth investigating. 10. Swelling in the face or neck. A tumor in the lung can sometimes press on a major vein that carries blood from your head and arms back to your heart. When this happens, it can cause facial swelling, especially around the eyes, or noticeable puffiness in the neck and upper chest. It might look like an allergic reaction, but it could be something far more serious. 11. Clubbing of the fingernails is a strange but telling sign. Your fingertips become wider or more rounded, and your nails curve more than usual. It's called clubbing, and it can occur in people with long-term oxygen deprivation, something that happens when lung function is reduced. This isn't common, but when it does appear, it's often overlooked. If your fingers look different, it's time for a closer look. 12. A feeling that something's just not right. Sometimes, the earliest sign is not physical, it's instinctual. You feel different. Something is off. Maybe it's not pain or a symptom you can describe, but a sense that your body is changing in a way you don't understand. Trust that feeling. You live in your body every day. You know when something doesn't feel right, and you're not imagining it. Important note, Having one or two of these symptoms does not mean you have lung cancer. These signs could be caused by many other conditions, most of which are not cancer. But the key is persistence. If a symptom is new, unusual, and especially if it's lasting longer than a few weeks, it deserves your attention. Coming up next, we'll talk about what to do if you recognize any of these signs, and why staying calm but proactive is the smartest step you can take. Hearing about the symptoms of lung cancer, especially when some of them sound familiar, can be unsettling. Maybe you've had a nagging cough, maybe you've been short of breath lately, or just not feeling like yourself. And now, your mind is racing with possibilities. But before you let fear take over, I want you to pause, take a deep breath, stay calm, and remember this. Noticing a symptom does not mean you have cancer. There are many reasons a person might develop a cough or feel tired. There are many explanations for weight loss, chest discomfort, or hoarseness. Most of them are far less serious than cancer and many are completely treatable. So, don't jump to conclusions. Don't Google yourself into panic. Don't imagine the worst. Instead, respond with clarity and confidence. The smartest thing you can do if you recognize one or more of the signs we've discussed is this. Start by paying attention to the pattern. When did the symptom begin? How often does it happen? Is it getting worse or staying the same? Is it affecting your daily life? Keeping a journal, even just short notes on your phone, can help you track the details and spot trends that matter. Next, schedule an appointment with your primary care doctor or a pulmonary specialist. You don't need to walk in and announce, "I think I have cancer." You just need to say, "Something feels different, and I'd like to look into it." A good doctor will listen. They'll ask questions. They may order a few tests, perhaps a chest x-ray, CT scan, or a simple blood test to help understand what's going on. These steps are not scary, they are empowering. They bring clarity. They give you information. If needed, you may be referred to a lung specialist, a pulmonologist, someone trained specifically to diagnose and treat conditions affecting the lungs. And if further testing is needed, they'll guide you through every step with care. Remember, taking action doesn't mean something is wrong. It means you're wise enough not to wait. Even if it turns out to be something minor like a lingering infection, seasonal allergies, or acid reflux, checking in early helps you feel at peace. It lets you move forward with confidence instead of anxiety. But if, by chance, something more serious is going on, you'll have caught it early. And that could be the decision that saves your life. Too many people wait. They wait for things to get worse. They wait until it's too late. Don't be one of them. Listen to your body now while you still have choices. Taking the step to see a doctor is not overreacting. It's being responsible. It's being strong. It's being the kind of person who values their health enough to act. And you don't have to go through it alone. Talk to someone you trust. Share your concerns with your family. Let your loved ones be part of your support system, because health is not a solo journey. You are not weak for having questions. You are strong for seeking answers. Now that you understand what to look for and how to respond, let's finish with a message that brings it all together, a message that puts the power back in your hands. Let's talk about how to take control of your health starting today. Now you know the facts. You understand the quiet ways in which lung cancer can begin. You've heard the signs, felt the urgency, and hopefully realized that early detection isn't just medical, it's personal. Because this isn't just about disease. It's about your life, your breath, your future, and the people who love you. Too often, we wait for health to become a crisis before we act. We ignore symptoms. We put off doctor visits. We tell ourselves we're too busy, too tired, or too afraid to find out what's really going on. But here's the truth. You are stronger than you think. And when you take control of your health, you don't just add years to your life, you add life to your years. The power to protect yourself is in your hands. The power to listen to your body. The power to speak up. The power to get checked before it's too late. And most importantly, the power to say, "I choose health. I choose clarity. I choose to take care of myself." Because lung cancer doesn't have to be a silent killer. Not if we learn to listen. Not if we act early. Not if we refuse to ignore the signs. You don't need to be a doctor to save a life. You just need to pay attention to yourself, to your loved ones, to what your body is trying to tell you. This isn't about fear. It's about freedom. Freedom to live fully, breathe deeply, and move forward with confidence. And even if you've been a smoker or had risks in the past, it's never too late to start paying attention. Your past doesn't define your future. What matters is what you do next. Make the call, book the appointment, have the conversation. Let today be the day you take control. Not tomorrow, not someday, today. Because nothing, absolutely nothing, is more important than your health, and you are worth every breath. If this video helped you understand lung cancer more clearly, if it opened your eyes to the silent signals your body may be sending, then don't let this be where it ends. Share this video with the people you care about. A friend, a parent, a coworker, a neighbor, Someone out there needs this information right now, and you might be the one who gives it to them. Send it to someone who's been coughing a little too long, someone who hasn't been feeling quite right. You're not just sharing a video, you're opening a door to better health. Leave a comment below. Let us know what stood out to you. Have you or someone close to you been impacted by lung issues? What made you watch today? Your words might give someone else the courage to act. Subscribe to our channel if you haven't already. This is part of a powerful series where we go deep into the most common and most dangerous types of cancer. Each video is created with care to help you protect your health and stay informed. And don't forget to like this video. It helps more people discover it, and it tells us this kind of content matters to you. In our next episode, we'll explore breast cancer, how to recognize it, how it affects both women and men, and what early signs are often missed. So hit that notification bell to get an alert the moment it's live. Most importantly, give yourself credit. You showed up today, you took time to learn, and that means you've already taken the first step toward protecting your future. Health is a journey, and we're walking it with you every step of the way. Stay aware, stay strong, and as always, take care of yourself and the people you love.